Ready to start, yeah?
Mm-hmm.
Okay, hi everyone. We've got our webinar this afternoon with the Clinician Engineer Hub. I'm Neel, founder and co-director with Ali Ettison, who had to sneak off for a meeting, but that's okay. So our speaker for this afternoon is Fredrik Ohrn, CEO of Bestor Consulting. Now, Fredrik has an immense amount of experience in the healthcare industry across Europe and Asia. He's not going to be talking specifically about artificial intelligence, but more importantly, implementation in healthcare. So Fredrik's going to start. Afterwards, there's going to be questions. Those questions are going to be moderated by Laura, Luxi, Faisal, and Maria. And for anyone that misses the actual event, it's going to be recorded and available on YouTube later. So Fredrik, go for it.
Thank you very much. It's a pleasure to be here and speak to you today about AI in healthcare, and more specifically a structured route to AI in healthcare, which, just like Neel said, we'll be talking a little bit about the technology, but also how to get it into the healthcare system and to make it actually reach patients and doctors. And first, I'd like to start briefly by presenting Beststore, the company of which I'm the CEO. We are 15 consultants. We are management consultants working with process development, project management, change management, digital transformation, and we have a couple of software products, the most famous one being Symphony, where we keep track of projects in large organizations and see how they're doing project-wise and financial-wise. We do analytics, hence the connection to AI. We work with predictive modeling, and in connection to that, we do BI visualization, specifically for healthcare and the banking and finance industry. And with the help of these two, we build automated decision support systems. And all of these topics I will touch on later on today. And we are specializing in life science and healthcare. So we combine our services in both management, consulting, and analytics, and offer that to healthcare and life science companies. So we do data modeling, where we inspect, clean, and transform data so that we can model data for prediction and help healthcare get rid of a lot of administrative work. Obviously, product management. We also do a lot of advisory services on healthcare, business models in healthcare, digitalization of healthcare, personalization of healthcare, and also person-centered care in healthcare, which are all hot topics today, but very few know how to approach them. And we combine everything we do here with change management to reach the desired goal. So moving into the topic for today, I want to start with the fundamentals of AI. What are we doing? Why are we doing this? The first question I usually ask is, what does healthcare of the future look like? Will it consist of AI? I would like to think so. I would also like to think that it's going to be a natural part of healthcare. We also discuss, will healthcare be data-driven? Will it be automated and person-centered? I think it can be all of these three. And to me, the key is to make the healthcare person-centered. That's the focus. So anything that cannot be, or anything that can be done by machines should be done by machines. But the actual patient, doctor, patient, nurse, patient, physical therapist meeting should be top of the line. You don't want patients leaving the hospital saying, they didn't treat me nice. you should have so much time to focus on the actual meeting with the help of AI and data handling in general, that the meeting will be outstanding. Every meeting with a doctor or a nurse should be the best meeting you ever have. So what is important when designing a modern care with the patient in the center? We want to design a modern healthcare. We want to use data. We want it to be data driven, and we want to use AI. And what is important? First of all, if we want to move into AI and working with data in healthcare, we have to focus on data sharing. Data sharing means that we sometimes have to give data into a larger pool for the better success. And sometimes this means sharing data across clinics in a large hospital, most often. Sometimes this means sharing data between 2 hospitals or more hospitals than that. Sometimes it means sharing data across borders between countries. This means that we have to adapt to the current legislation. We will run into hurdles. When working with AI, you have to improvise, you have to adapt, and you have to overcome these hurdles that we constantly will run into. We can't stop because there are hurdles. There will always be hurdles. So set your mind on overcoming these hurdles. That's something important to bring into this kind of work. One sort of hurdle in terms of AI and in all industries really is procurement. In Europe, for instance, we have to procure IT solutions. Before a hospital can purchase an IT solution or use an AI IT solution, it has to be procured. And how do you define something that learns? So if you go to your purchasing department, your procurement department, and say, I'm purchasing a system that will learn as we go. The way they are trained is that they say, oh, so that means we have another product in about 6 months. That is not generally considered an upgrade for the purchasing people. So there we have a hurdle right away. Then, even though we know of data sharing, the issues with data sharing, we know of procurement, we can still start a project, I would say. And the key to do this is I know I'm mostly speaking to doctors here, I think, but you have to have an engaged clinician. Doctor's knowledge needs to be complemented by the knowledge in a data scientist, though. So the doctors, we would like to see doctors with a larger understanding of data science. But we also have to realize that doctors are good at being doctors, or they're excellent at being doctors, and data science is another training. So these two have to work together. The doctors need to be involved and engaged throughout the project. And then we have to have a broad knowledge base working through the AI project. And we can start by saying a huge platform vendor has no or little specialization in healthcare, but they know how to make it through a public procurement, that kind of process. The small player, though, will challenge and be in the forefront. And to reach success when working with AI in healthcare, we need both size and guts. So therefore, collaboration is key. Collaboration between healthcare and technology, healthcare and science, data science preferably, but also collaboration between companies and hospitals, university hospitals primarily, I would say. And running an AI project, we at Bestor, we divide the project into work streams, 5 of them. One is coordinating and doing the project management to keep requirements together, bridge between business value for the patient and IT. This is key. Someone has to be there to make sure all these 3 are taken care of throughout the project. The second one is data quality, and I'm going to spend a little bit of time on that in a second. What data do we have? Is it ready to be used to build predictive models? More often than not, it isn't. And we work a lot with proms and prems. And I have to be honest, I am not sure that's the terminology you use. This differs a lot. But the patient-reported data on outcome and experience. So building this AI project, we prepare and plan for an increased reporting from patients with the aim of reducing administration for staff and increasing availability. So this is the key. If we can get patients to report on outcome and experience throughout their disease journey, we can save time for doctors and nurses and others inside of the hospital. And when we do this, it means that we're going to change the way we work. The way you are being trained as medical students today will not be the way you work when you graduate. When you enter the hospitals in a year from now or 3 years from now, the hospitals will be differently organized. They will mostly work differently than what you are being trained today. And when we enter the hospital with AI solutions, we have to work with change management. And we have to change the way patients look at healthcare as well. And we want to have the AI system working in the background, making decisions for the doctors primarily. But we also want it to be possible or available for doctors to follow the process where the AI system is making decisions, so we visualize the data along the process. So the doctors and nurses can see where are we making decisions and why are we making these decisions and why is the system making these decisions for us. So this is the project setup. So the thing, if you go into a forum for hackers, for data scientists, and ask them what is the most overlooked part of the AI work, most will say data quality, because every person alive today, more or less, know that we have a lot of data everywhere. We have a lot of data in banks, in schools, in hospitals. There's the stores we use online and the real life stores and so forth. We know that data is being collected and stored. But the data being stored is not ready for analysis right away. So we have to work on the data to make it available to the data scientists. So there's 6 different parts in this data quality work that we have to spend a lot of time on usually. Data integration, the data sources that we decide we need, which format is the data in, and we have to sync the timestamps. And I think you understand this more than me. If you work in healthcare, if you're a doctor or a nurse, you understand that lab tests are taken one day at a certain time. The operation or the surgery is done 2 or 3 days later. Are these connected? And in what sense are they connected? The machines have to be told how they are connected, if they are. Statistical analysis. We do variable statistics and missing data handling. So handling of data that is not there, that should be there. May it be lab tests, may it be patient-reported data, and so forth. We do data mining. We look at patterns in the data collected across the different systems and sources. We look at covariation between these data points, and we do predictor screening. So we want to build a predictive prescriptive model, and which variables are most important when building this model. That's predictor screening, and it's part of the data quality process. We work with data handling, the database routine for storage. We look at extract, transform, and load, how to sort of take data out of the data sources, transform it, and load it into the machine that is going to do the calculations. Security is always important. Data cleanse. The main cleansing period for doing this project is when we've done the handling, the integration, the analysis, and the mining. We have to clean the whole database, so make sure that the numbers, the variables that we have, the data connected to these data points are exactly the data that we need for the calculations. Are there matching data? Which rules for the data cleanse should be used, and so forth. And then the last box here says knowledge and reasoning. And I think this is very important from a safety, security perspective, obviously, but also for the transition, for the change management part, to sit down and say, this is what we have gathered, this is the analysis we've done, this is what the data analysts, data scientists say. Does this make sense? And doctors and specialists can say, this doesn't look right. I don't know why it suggests that this kind of patient should not have surgery. We always do surgery on this patient. Okay, is the data correct? Can we learn something from this? I've had numerous discussions with doctors around this when they say this must be wrong. This is not what we see. And we tell them that the data we're looking at is data that you have entered into the system. So it's just that if you are a doctor, you see, let's say you see 30 patients a day for 6 months, and you enter the data into various systems. In Sweden and in Asia, we worked with quality registers. We have the EHR, and there's another system, and there may be a patient system. This data is being analyzed, and then you say, I don't trust it, it's not right. Then there's something wrong with how we entered the data. So the knowledge and reasoning part is important. And then we usually gather a group of specialists around the table and look at the data and say, what do we have? Can we trust it? And this is to illustrate a couple of things. A predictive model in an automated decision support system. The misconception is that we create an algorithm, or a data scientist will create an algorithm and will test it on a number of patients. We'll do our research along the way, and it's a model. The fact is that this decision support system consists of 5 different parts, and there are, in the first part, which is data, there are 4 stages. So we gather data from different applications. we set up so-called pre-rules, and then we integrate the electronic healthcare records, the patient-reported data and quality registers, for instance, and integrate with our system or the machine learning system. And then the second stage, 2 steps, calculations, different models, that's the HHK and KALP, different models and routines for the different machine learning platforms we work with. And then the second stage in the second phase is the pre-score rules. So now we're getting close to the actual scoring in this case, saying this patient is at high risk of getting a flare-up, or of a high risk of needing to go to the emergency room. So that's the score that we want to look at. We want to avoid the patient wants to avoid to go to the emergency room, or the patient would like to avoid to have this flare-up. Is there anything healthcare can do? Is there anything the patient can do? So we set the pre-score rules. We move into the score section. That's the prediction model. This is where the model or models work. But it's very rare that it's only one model. There are usually 2 or 3 at least models working together, and working together with rules. So there will be a set of rules working with the prediction models. And then there are post-score rules as part of the decision part. So you get a sort of a suggestion from the machine saying, we suggest that you call this patient because we don't want him or her to come to the emergency room, and we can see that there's a risk. And a post-score rule would say, but this patient is between 20 and 25, and we know that there can be a high value in this specific lab test, but it doesn't mean that they're doing that well that they're going to go to the emergency room. Excuse me. So that's how the post-score rules work together. And then you log the outcome. You return it to the patient system, the electronic health record, and make it workable for healthcare. The reason I'm showing this is that the project will be complex, and you have to take this under consideration when you move into it. You don't just do this on the side. You say, this is something that we would like the machine to handle for us, and you change the process with the help of all this work. And there are several stages, and there are several parts in each stage. And you have to also start somewhere. So I would say that the degree of maturity is the benefit and value is related to the degree of maturity you're at a certain point in time. So we start at the standard point is what happened. We look at something. Today we had 15, or this week we had 15 patients with rheumatology or RA in the emergency room. Okay, that's a fact. If we do a drill down on this, we would have to look at what exactly happened. Why did we have 15 patients coming into the emergency room? They're not prioritized patients, but it's stressful for the patient to come to the emergency room. We would not like to see them there. They don't want to go to the hospital at all. And then we can have a prognosis saying, if we don't do anything, nothing changes, we will have about 12 or 15 RA patients next week again. So part of the drill down work will be statistics saying, why did it happen? And we visualize this for healthcare staff, for doctors and nurses, saying this is what it looks like in the emergency room with RA patients. So the visualization helps us to make a decision saying, okay, let's analyze why they are visiting the ER at this high rate. Okay, can we predict? Can we have a predictive system working for us, saying there is a risk of 12 patients coming into the emergency room? Can we stop that? And then after the visualization, the analysis, we're moving into machine learning, saying if they learn along the way, the machine will be better and better at this. But also the maturity level of the organization will increase, because you have a discussion going saying, this is how we work with data. We prepare the data for analysis. We know why we enter data into the system, and we know why we enter it in a certain way into the system. So this is a general slide of maturity versus benefit and value in an organization. And I think we should remember that we always start at the bottom, and then we move at different pace towards the top. And I think we should be humble in the beginning, saying this is new to us. We have to let it take some time. So I tried to look at the key takeaways from the work with AI and making it a part of healthcare. We need to have an engaged, informed, and dedicated clinician. So in the beginning of the project, throughout the project, and finishing the project, we have to work with a common terminology in terms of data and also what we talk about. Are we talking about AI? Are we talking about machine learning? And what do these lab tests actually mean? We know that some definitions of flare-ups in chronic diseases, for instance, only here in Stockholm, where I'm based at the moment, the definition of a flare-up is different from hospital to hospital, which is interesting when you think that the human body is pretty similar across the hospitals in this town, at least. We need to share data, and this sounds natural when you think that you will have access to other data than you normally work with, but it also means that you have to be willing to share data with others somehow. You have to look into that. There are several stages in predictive work that you have to go through. There's a development curve in terms of understanding of data handling, and reaching the ultimate, so to say, machine learning stage. Data quality work is an often overlooked part in the process, and I cannot stress this enough. I think you have to spend time with data quality. Once the data has been cleansed and cleared, if you have a data scientist, they can do wonders, but data quality is hard work. And project management and change management have to be integrated into this scientific work, because what does this mean for the process, for the care process for the patients? We want it to be effective when we bring AI or predictive models into healthcare, which means that these models should be doing some of the work that a human is doing today. what does this mean? And what does this do for the staff and the roles that we are used to? So if you enter a hospital today and you look at the different tasks that are being handled by secretaries, nurses, doctors, physical therapists, the business people, if you're at a big hospital, which part of their work are we taking away or changing with AI and predictive modeling? And how are we handling that? They can probably do something else in the hospital, because as I said in the beginning, if we build these models and make them work, the meeting with a doctor, the meeting with a nurse will be the best meeting that the patient has that day. And we have to make sure that the person-centered care is the focus. So everything that the machines can do for us, the calculations and collection of data perhaps by sensors and so forth, should be done by machines. The personal meeting, the explanations, the handling of the difficult talks should be done by humans in the most human way and best way you can imagine. So that's why we are dedicated and why we love this work so much. So I think I stop there and I leave it to the moderator to do the questions.
Brilliant. Thank you so much, Fredrik. That was a very interesting, informative talk. Really thank you on behalf of all of us. So we have a question in the chat already coming in from Daniel, who asks, what do you think are the biggest challenges of deploying machine learning in healthcare?
I think there are several. One is the culture. Who should be deciding regarding diseases and humans in terms of disease and the well-being. I think there is a rather big question regarding competition between doctors mainly and the machines. So the idea here is you work with the machines. They don't work instead of you, but you work with them. And I think that is something we have to work hard on, all of us, to start now already. But that's a big challenge.
Brilliant, thank you. And just as a follow-up, what do you think machine learning engineers get wrong while they work and communicate with clinicians? What are the most common issues that you've sort of found in this area so far?
The biggest challenge is often that we don't always succeed in explaining how complex each diagnosis actually is. We would like to think that it's very digital, on or off, are you sick or not? We look at chronic diseases, you have 1,000 patients, they all have different kinds of diseases, and they are all severely ill in different ways, and there are only some parts of the disease that can be decided by on or off, so to say. Is it good or bad? You can give them medicine and treatments that works really well with some patients, doesn't work at all with another patient. So I think the complexity is a challenge to transfer the understanding of from doctors to scientists, so to technicians.
Brilliant. Thank you so much, Fredrik. Just one final question, and then I think we'll leave it to this if you've still got time. So what are some of the clinician-led roles at your company and experiences in the AI industry from Faisal?
Can you repeat that?
Yes. So what are some of the clinician-led roles at your company and experiences in AI industry? I guess this person's just trying to ask what roles are available for healthcare workers in AI.
Yeah, the knowledge or the experience that we have here is with medical treatments. What do you say, in internal medicine background, and in a combination with data handling and an understanding of what data can do if you work with it properly. Other work experience and experiences is robotics. What can robots do in healthcare? Everything from surgery to administrative work to lab work. So it's a combination of mainly internal medicine focus in combination with data knowledge, so to say, and to some extent data science.
Brilliant. Thank you so much, Fredrik, for coming in today and sharing your experiences.
Sure, it was a pleasure.
It was a pleasure to have you, and hopefully we answered all of the questions. And yeah, thank you for a brilliant talk.
Thank you very much. Thank you. And if you have any questions, you are welcome to contact me anytime. You can see my email on the screen and social media contact link as well.
Brilliant. Thank you.
Will do, Fredrik. Thank you very much.
Great. Thank you. Speak soon. Take care.
Bye.